Question 1. Nurse admits widowed woman for emergency heart surgery. She is asking the nurse who will make decisions if her procedure goes wrong. Which of these is the correct course of action for the nurse? A. The nurse should inform the physician and advocate for the delay of surgery until the patient seeks legal counsel. B. The nurse should inform and educate this client about advance directives, help coordinate their creation, and ensure they are in the medical record. C. The nurse is not involved with advance directives. She should alert a social worker that the patient needs help establishing advance directives. D. The nurse should inform and educate this client that the nurse will act as a healthcare proxy for the patient, should the client be rendered incapable of making medical decisions for herself. Question 2. A terminally ill male patient who is mentally competent declines palliative radiation for his inoperable brain tumor. The nurse knows that this patient is refusing treatment based on which of these legal standards? A. The Uniform Anatomical Gift Act. B. The Patient Self-Determination Act. C. Patient's Bill of Rights. D. The Health Insurance Portability and Accountability Act. Question 3. Which of these examples is most illustrative of a nurse acting as an advocate for the patient? A. Telling the patient which treatment would be best based on your clinical opinion and past experience. B. Sharing a patient's status over the phone with a concerned neighbor who calls to ask how the patient is doing. C. Explaining a patient's test results in greater detail after they've been given by the treating practitioner. D. Giving a post-operative patient pain medication even though he or she has refused it. Question 4. A nurse is assigned 5 patients on a medical surgery floor. There are 2 LPNs and 1 nursing assistant also working the shift. Which of the following interventions are appropriate to delegate to the supportive nursing staff? Select all that apply. A. Auscultating breath sounds on a 70-year-old client with emphysema. B. Changing bed linens on a 44-year-old client while he is in radiology for an MRI. C. Assisting a 83-year-old client with history of unstable gait to the restroom. D. Administering ivorytoradol, ketorolac tromethamine, to a 56-year-old recovering from a stroke. E. Taking vital signs on a 65-year-old client whose blood pressure was last 80/46. Question 5. Which of these scenarios correctly describes proper delegation by a nurse? A. Delegating a bath of a quadriplegic patient to a nursing assistant. B. Delegating a nursing assistant to educate a patient on a new medication. C. Delegating wound assessment on a post-operative patient complaining of increased pain to a nursing assistant. D. Delegating vitals on a patient who is experiencing chest pain to a nursing assistant. Question 6. The nurse is planning to delegate tasks for her patients at the nursing home. The nurse knows that she does not need which of these to ensure successful supervision of the delegated tasks? A. The ability to provide clear direction and communication. B. The ability to provide timely follow-up. C. The ability to problem solve. D. The ability to provide criticism and negative feedback. Question 7. A 75-year-old female recovering from a broken hip is being discharged from a healthcare facility. After completing her care plan after discharge, the nurse learns that her patient has a 78-year-old husband with dementia that she cares for at home. He has been staying with other family members during her convalescence. Which of these is the correct course of action for the nurse? A. Leave the discharge care plan as it is. Assume that the family will continue taking care of her husband. B. Reevaluate and revise her discharge care plan to ensure that the patient and her husband are both well taken care of at home. C. Trust that the patient's rehabilitation has been sufficient, and she can immediately resume all previous activities related to caring for her husband at home. D. Confront the patient and ask her why she didn't disclose the information about caring for her husband prior to completing her discharge care plan. Question 8. A nurse is taking care of a previously healthy adult patient with a newly diagnosed serious medical condition. The patient is apprehensive and confused by all of the information, tests, test results, and the number of medical practitioners involved in the care plan. The nurse knows that it is her job to inform and educate the patient on the rights and responsibilities of those receiving health care as specified in the patient's Bill of Rights. According to this document, which of the following is not included in this discussion? A. The responsibility to inform the healthcare staff of any previous conditions and medications. B. The right to be informed about and participate in the decisions regarding medical treatment. C. The right to choose any provider or plan for healthcare. D. The right to refuse any treatment. Question 9. A nurse has a 75-year-old patient with COPD and diabetes that requires care from a pulmonologist, endocrinologist, respiratory therapist, physical therapist, occupational therapist, as well as services from a social worker and registered dietitian. The nurse knows that this interdisciplinary action across the various areas of medicine is known as _______. A. Cooperation. B. Facilitation. C. Collaboration. D. Integration. Question 10. The nurse working in the ICU takes a phone call from an unknown person inquiring about the status of one of the patients under her care. Which of the following is the best course of action for the nurse? A. Check the patient's chart to see if the person is listed to receive confidential information about the patient's medical condition and care. B. Tell the person that the information cannot be given over the phone. C. Take all of the caller's information and list it in the patient's chart prior to sharing the requested information. D. Tell the person the patient's condition and reassure them the best care is being given. Question 11. In which of these situations is a nurse in violation of HIPAA guidelines? A. The nurse jots a patient's name and vitals on a scrap piece of paper rather than directly into the medical record, but shreds it after the information has been recorded. B. The nurse has a conversation about a patient's change in status with the nurse that's about to take over care in earshot of a nurse's aide who is not assigned to that patient. C. The nurse has a conversation with the patient about the results of his labs and other diagnostic tests with the patient's wife present in the room. D. The nurse forgets to close out a patient's electronic medical record and leaves the information on the monitor where it can be read by other patients and visitors. Question 12. A nurse is preparing discharge arrangements for an elderly client with a right ankle fracture. The client is scheduled to go to a skilled nursing and rehabilitation facility. Which of the following interventions are appropriate for providing continuity of care during the facility transition? Select all that apply. A. Secures a client bed at the new facility. B. Transfers the complete medical record. C. Discards the current medication schedule as it will change at the new facility. D. Discusses the transport and transfer information with the client and family. E. Schedules follow-up appointment with the surgeon in 6 weeks. Question 13. A nurse has just received report on all 4 of his patients for his upcoming shift on a medical surgical floor. Which of the patients should the nurse attend to first? A. A 55-year-old who is 24 hours post-operative for a bilateral mastectomy complaining of pain that is 6 out of 10. B. A 70-year-old who is 12 hours post-operative for a total left knee replacement who has some serosanguinous oozing from the incision. C. A 63-year-old with atrial fibrillation treated with digoxin and metoprolol who is in a normal rate and rhythm. D. A 72-year-old with COPD complaining of worsening dyspnea. Question 14. The parents of a child, age 6, who will begin school in the fall, ask the nurse for anticipatory guidance. The nurse should explain that a child of this age, A, is highly sensitive to criticism. B, rebels against scheduled activities. C, still depends on the parents. D, loves to tattle. Question 15. While preparing to discharge an 8-month-old infant who is recovering from gastroenteritis and dehydration, the nurse teaches the parents about their infant's dietary and fluid requirements. The nurse should include which other topics in the teaching session? A. Safety guidelines, B. Preparation for surgery, C. Toilet training, D. Nursery schools. Question 16. Nurse Bettina should begin screening for lead poisoning when a child reaches which age? A. 3 months, B. 12 months, C. 24 months, D. 30 months. Question 17. When caring for an 11-month-old infant with dehydration and metabolic acidosis, the nurse expects to see which of the following? A. Tachypnea, B. Shallow respirations, C. A reduced white blood cell count, D. A decreased platelet count. Question 18. After the nurse provides dietary restrictions to the parents of a child with celiac disease, which statement by the parents indicates effective teaching? A. We'll follow these instructions until our child has completely grown and developed. B. We'll follow these instructions until our child's symptoms disappear. C. Our child must maintain these dietary restrictions until adulthood. D. Our child must maintain these dietary restrictions lifelong. Question 19. A parent brings a toddler aged 19 months to the clinic for a regular checkup. When palpating the toddler's fontanelles, what should the nurse expect to find? A. Open anterior and fontanelle and closed posterior fontanelle. B. Closed anterior and posterior fontanelles. C. Closed anterior fontanelle and open posterior fontanelle. D. Open anterior and posterior fontanelles. Question 20. Patrick, a healthy adolescent, has meningitis and is receiving IV and oral fluids. The nurse should monitor this client's fluid intake because fluid overload may cause A. Dehydration, B. Hypovolemic shock, C. Cerebral edema, D. Heart failure. Question 21. An infant is hospitalized for treatment of non-organic failure to thrive. Which nursing action is most appropriate for this infant? A. Encouraging the infant to hold a bottle. B. Keeping the infant on bed rest to conserve energy. C. Rotating caregivers to provide more stimulation. D. Maintaining a consistent, structured environment. Question 22. The mother of Gian, a preschooler with spina bifida, tells the nurse that her daughter sneezes and gets a rash when playing with brightly colored balloons, and that she recently had an allergic reaction after eating kiwi fruit and bananas. The nurse would suspect that the child may have an allergy to A. Bananas, B. Color dyes, C. Kiwi fruit, D. Latex. Question 23. Christina, a mother of a 4-year-old child, tells the nurse that her child is a very poor eater. What is the nurse's best recommendation for helping the mother increase her child's nutritional intake? A. Use specially designed dishes for children, for example, a plate with the child's favorite cartoon character. B. Allow the child to feed herself. C. Only serve the child's favorite foods. D. Allow the child to eat at a small table and chair by herself. Question 24. A nurse is taking care of an elderly patient with a significant essential tremor that includes an intentional tremor. Which of these assistive devices would be most beneficial to this patient for his activities of daily living? A button hook, a voice amplifier, a dressing stick, a leg lifter. Question 25. An emergency room nurse is giving discharge instructions to a 15-year-old male who has suffered an orthopedic injury during a soccer game. He has been instructed to use crutches and limit weight bearing until further evaluation by a specialist. When instructing this patient, which of these is the correct way to describe the proper use of crutches? A. Straighten the arms and place your body weight on either the hand grips or armpit pads as you swing your uninjured leg as far as you can in front of you. B. Keeping the arms slightly bent, place the crutches as far as you can in front of you, and allow your body weight to rest on the armpit pads while you swing your uninjured leg to meet the crutches. C. Keeping the arms slightly bent, place the crutches about 1 foot in front of you, shifting your body weight to the hand grips as you swing your uninjured leg to or just in front of the crutches. D. Straighten the arms and allow your body weight to rest on the armpit pads as you swing your uninjured leg in front of you, then pull the crutches to your standing leg. Question 26. A patient has been on bed rest for a week after a fractured left hip. Which of the following symptoms, if noted in the patient, would be considered signs of complications due to immobility? Select all that apply. A. Area unable to be blanched on the patient's sacrum. B. The patient complains of pain, swelling, and tenderness in the left calf. C. The patient uses the bedpan to void. D. The patient's skin has a faint yellow tinge. E. The patient's blood sugar is 79. F. Crackles in the bases of the patient's lungs. Question 27. A patient with dementia has been identified as having a high BUN in lab results. Which of the following non-pharmacological actions would be best for the nurse to take? A. Assist the patient to the bathroom every morning. B. Place water in front of the patient every hour to encourage oral hydration. C. Ask the charge nurse how best to solve the problem. D. Notify the physician that the patient is in kidney failure. Question 28. A patient with Cushing's disease asks the nurse to help him choose a meal for dinner later. Which of the following meals is the best option? A. Pork chops in cream sauce with mashed potatoes and carrots. B. Mexican-style beef with guacamole and beans on the side. C. Hamburger with French fries and apple slices. D. Roasted chicken with corn and green beans. Question 29. A cast is applied to a 13-month-old girl for the treatment of talipes equinovarus, clubfoot. Which of the following instructions is essential for the nurse to give the child's mother regarding her care while in the cast? Select all that apply. A. Check the temperature and color of the skin on your child's feet. B. It is important to do frequent skin checks around the edges of the cast. C. Call the doctor if the child has pain unrelieved by medication. D. Pay attention if your child mentions any numbness or tingling in her toes. E. Reassure your child that this type of cast will be removed in a week for good. F. Ask the child once per day if she feels that the cast is too tight. Question 30. A 90-year-old female has been bedridden for 2 weeks. Which of the following complications, if observed by the nurse, is not expected? A. Decrease in bone density. B. Loss of short-term memory. C. Atelectasis. D. Loss of appetite. Question 31. The nurse receives a call from a patient with type 1 diabetes. The patient asks for exercise guidelines in regard to eating and insulin administration. Which of the following instructions are most appropriate for the nurse to give to the patient? Select all that apply. A. You may want to leave an energy drink with electrolytes in your gym locker in case you need it. B. Be sure to eat a simple carbohydrate snack before you exercise. C. Do not administer insulin immediately before and after exercise. D. It is smart to alert your gym that you have type 1 diabetes. E. It is best to eat a more complex carbohydrate before you exercise so that you don't bottom out. Question 32. Which of the following is least likely to influence the potential for a client to comply with lithium therapy after discharge? A. The impact of lithium on the client's energy level and lifestyle. B. What the client's friends think of his need to take medication. C. The need for consistent blood level monitoring. D. The potential side effects of lithium. Question 33. An adult client's insulin dosage is 10 units of regular insulin and 15 units of NPH insulin in the morning. The client should be taught to expect the first insulin peak, A, in 10 to 12 hours, B, as soon as food is ingested, C, in 2 to 4 hours, D, in 6 hours. Question 34. Mr. Bates is admitted to the surgical ICU following a left adrenalectomy. He is sleepy but easily aroused. An IV containing hydrocortisone is running. The nurse planning care for Mr. Bates knows it is essential to include which of the following nursing interventions at this time? A. Keep flat on back with minimal movement to reduce risk of hemorrhage following surgery. B. Monitor blood glucose levels every shift to detect development of hypo or hyperglycemia. C. Administer hydrocortisone until vital signs stabilize, then discontinue the IV. D. Teach Mr. Bates how to care for his wound since he is at high risk for developing post-operative infection. Question 35. Which of the following is least likely to influence the potential for a client to comply with lithium therapy after discharge? A. The impact of lithium on the client's energy level and lifestyle. B. What the client's friends think of his need to take medication. C. The need for consistent blood level monitoring. D. The potential side effects of lithium. Question 36. Nurse Celine is caring for a client with clinical depression who is receiving MAO inhibitor. When providing instructions about precautions with this medication, the nurse should instruct the client to A. Avoid chocolate and cheese. B. Avoid walking without assistance. C. Take the medication with milk. D. Take frequent naps. Question 37. When caring for a client with total parenteral nutrition, TPN, what is the most important action on the part of the nurse? A. Sterile technique for dressing change at IV site B. Monitor for cardiac arrhythmias C. Maintain strict intake and output records D. Record the number of stools per day. Question 38. A 2-year-old child with congestive heart failure has been receiving digoxin for 1 week. The nurse needs to recognize that an early sign of digitalis toxicity is A. bradypnea, B. vomiting, C. tachycardia, D. failure to thrive. Question 39. An adult is hospitalized for treatment of deep electrical burns. Burn wound sepsis develops and mafenide acetate 10%, sulfamelon, is ordered bid. While applying the sulfamelon to the wound, it is important for the nurse to prepare the client for expected responses to the topical application, which include A. Possible severe metabolic alkalosis with continued use. B. Black discoloration of everything that comes in contact with this drug. C. Severe burning pain for a few minutes following application. D. Chilling due to evaporation of solution from the moistened dressings. Question 40. A 2-year-old child is receiving temporary total parental nutrition, TPN, through a central venous line. This is the first day of TPN therapy. Although all of the following nursing actions must be included in the plan of care of this child, which one would be a priority at this time? A. Monitor serum glucose levels. B. Check results of liver function tests. C. Use aseptic technique during dressing changes. D. Maintain central line catheter integrity. Question 41. Mrs. Johansson. E's physician has prescribed tetracycline 500 mg PACU 6H. While assessing Mrs. Johansson's nursing history for allergies, the nurse notes that Mrs. Johansson's is also taking oral contraceptives. What is the most appropriate initial nursing intervention? A. Tell Mrs. Johansson she should stop taking oral contraceptives since they are inactivated by tetracycline. B. Notify the physician that Mrs. Johansson is taking oral contraceptives. C. Administer the dose of tetracycline. D. Tell Mrs. Johansson to use another form of birth control for at least 2 months. Question 42. Your home health client has been vomiting for several days. You now find her lying in her bed. She is pale and lethargic, and her eyes are dull. She is also anxious. Which of the following is most likely? A. Fecal impaction. B. Congestive heart failure. C. Multiple sclerosis. D. Hypovolemic shock. Question 43. When assessing a patient in the post-anesthesia care unit, PACU, the nurse should first check the patient's A. Level of consciousness, B. Ability to move, C. Respiratory status, D. Level of pain. Question 44. A new patient is unable to perform oral hygiene. Which of the following instructions should the nurse give to the nurse aide? A. Rinse the patient's mouth with mouthwash a few times during your shift. B. Check the entire mouth each time oral hygiene is done and document your observations. C. Use a soft toothbrush to brush the patient's teeth after every meal. D. Use a soft foam applicator to swab the tongue, gums, and lips every 2 hours. A 50-year-old blind and deaf patient has been admitted to your floor. As the charge nurse, what is your primary responsibility for this patient? A. Communicate with your supervisor about your patient's safety concerns. B. Let others know about the patient's deficits. C. Continually update the patient on the social environment. D. Provide a secure environment for the patient. A pediatric nurse has been assigned to assist with a bone marrow biopsy for a 7-year-old girl. Conscious sedation will be used for the procedure. What is the nurse's primary responsibility? A. Communication with the child's parents. B. Application of the topical anesthetic ointment. C. Documentation of the entire process. D. Monitoring the child during the procedure. Question 47. The nurse is caring for a child immediately after surgical correction of a ventricular septal defect. Which of the following nursing assessments should be a priority? A. Auscultate for pulmonary congestion. B. Assess for post-operative arrhythmias. C. Monitor equality of peripheral pulses. D. Blanch nail beds for color and refill. Question 48. The nurse is preparing a client who will undergo a myelogram. Which of the following statements by the client indicates a contraindication for this test? A. I can't lie in one position for more than 30 minutes. B. I suffer from claustrophobia. C. I developed a severe headache after a spinal tap. D. I am allergic to shrimp. Question 49. When caring for a client with a post-right thoracotomy who has undergone an upper lobectomy, the nurse focuses on pain management to promote A. Coughing and deep breathing, B. Range of motion exercises, C. Relaxation and sleep, D. Incisional healing. Question 50. A nurse is teaching a patient with type 1 diabetes about measures to prevent long-term complications of the disease. The nurse should include which of the following instructions? A. Wear shoes made of artificial fibers. B. Avoid wearing insulated boots in cold weather. C. Wear slippers when hanging out around the house. D. Wear knee-high nylons instead of pantyhose. Question 51. A patient begins hyperventilating due to a panic attack. The registered nurse knows that the correct intervention is to A. Have the patient breathe into a paper bag. B. Call the physician. C. Have the patient bear down. D. Put the patient on 2 L of oxygen. Question 52. The patient below has just been admitted to the ER following a motor vehicle accident. Describe the positioning of this patient with the most specific term. A. Supine. B. Decorticate. C. Decerebrate. D. Lateral. Question 53. You are a nurse on a medical surgical unit who is caring for a patient with Graves' disease. The patient has just returned from a thyroidectomy. Which of the following statements from the patient would require further assessment by the nurse? A. My lips feel like they are tingling. B. My throat feels sore and my voice is hoarse. C. I have a headache. D. I hope I will be allowed to drink coffee now. Question 54. A patient comes into the ER complaining of chest pain and shortness of breath. What action does the nurse perform first? A. Administer a beta blocker. B. Administer oxygen 2L by nasal cannula. C. Auscultate the patient's lungs. D. Administer nitroglycerin sublingually. Question 55. A patient with a history of chronic kidney disease is scheduled for a renal biopsy. Which action by the nurse is the highest priority? A. Ensure the patient is NPO for 8 hours before the procedure. B. Administer intravenous sedation to the patient prior to the procedure. C. Assess the patient's coagulation profile. D. Teach the patient about the potential complications of the biopsy. Question 56. A client with heart failure is prescribed furosemide, Lasix. Which laboratory value does the nurse monitor closely when administering this medication? A. Serum potassium levels. B. Serum calcium levels. C. Serum sodium levels. D. Serum glucose levels. Question 57. The nurse is caring for a client with a history of chronic obstructive pulmonary disease, COPD. Which intervention should the nurse prioritize to promote effective breathing? A. Encouraging the client to perform pursed lip breathing. B. Administering bronchodilators as prescribed. C. Assist the client in assuming a high Fowler's position. D. Providing supplemental oxygen via nasal cannula. Question 58. A client with diabetes is prescribed metformin. The nurse teaches the client about the medication and instructs them to report which symptom immediately? A. Nausea and vomiting. B. Increased urination. C. Muscle weakness. D. Yellowing of the skin. A post-operative client who had abdominal surgery is at risk for the development of deep vein thrombosis, DVT. Which intervention should the nurse prioritize to prevent DVT? A. Assisting the client in ambulating early and frequently. B. Applying warm compresses to the lower extremities. C. Administering prophylactic anticoagulant medication. D. Using intermittent pneumatic compression devices. Question 60. When assessing a newborn whose mother consumed alcohol during the pregnancy, the nurse would assess for which of these clinical manifestations? A. Negative Babinski sign, hyperreflexia, deafness. B. Shortened limbs, increased jitteriness, constant sucking. C. Strong tongue thrust, short palpebral fissures, simian crease. D. Wide-spaced eyes, smooth philtrum, flattened nose. Question 61. When observing 4-year-old children playing in the hospital playroom, what activity would the nurse expect to see the children participating in? A. Playing cooperatively with other preschoolers. B. Competitive board games with older children. C. Playing with their own toys alongside with other children. D. Playing alone with handheld computer games. Question 62. While the nurse is administering medications to a client, the client states, "I do not want to take that medicine today." Which of the following responses by the nurse would be best? A. That's okay, it's all right to skip your medication now and then. B. Is there a reason why you don't want to take your medicine? C. Do you understand the consequences of refusing your prescribed treatment? D. I will have to call your doctor and report this. Question 63. Which nursing approach would be most appropriate to use while administering an oral medication to a 4-month-old? A. Place in supine position. Administer medication using a plastic syringe. B. Place medication in 45 cc of formula. C. Place medication empty nipple. D. Place medication in a full bottle of formula. Question 64. What question would be most important to ask a male client who is in for a digital rectal examination? A. Have you noticed a change in the force of the urinary system? B. Do you notice polyuria in the AM? C. Do you notice any burning with urination or any odor to the urine? D. Have you noticed a change in tolerance of certain foods in your diet? Question 65. Which nursing intervention would be a priority during the care of a 2-month-old after surgery? A. Encourage stroking of the infant. B. Demonstrate to the mother how she can assist with her infant's care. C. Restrain all extremities. D. Minimize stimuli for the infant. Question 66. The family of a 6-year-old with a fractured femur asks the nurse if the child's height will be affected by the injury. Which statement is true concerning long bone fractures in children? A. Growth problems will occur if the fracture involves the periosteum. B. Adequate blood supply to the bone prevents growth delay after fractures. C. Children usually heal very quickly, so growth problems are rare. D. Epiphyseal fractures often interrupt a child's normal growth pattern. Question 67. A client is admitted to the hospital with a history of confusion. The client has difficulty remembering recent events and becomes disoriented when away from home. Which statement would provide the best reality orientation for this client? A. Good morning. Do you remember where you are? B. How are you today? Remember you're in the hospital. C. Good morning. You're in the hospital. I am your nurse, Elaine Jones. D. Hello, my name is Elaine Jones and I am your nurse for today. Question 68. The nurse is instructing a client who has just been prescribed fluoxetine, Prozac, for depression. At what time of day should the client take the medication? A. Midday. B. Bedtime. C. Morning. D. Dinner. Question 69. All of the following are symptoms of depression except A. Irritability. B. Inability to decide. C. Increased sex drive. D. Insomnia. Question 70. When assessing a child who presents to the emergency department with scalds from hot liquid from a stove, which body area may indicate possible abuse? A. Burns on the back of the body. B. Burns on the extremities. C. Burns on the front of the body. D. Burns on the buttocks. E. Question 71. The nurse is doing an initial intake with a 19-year-old female who was diagnosed with an eating disorder. The client says, I hate the way I look. I'm so ugly. What is the nurse's best response? A. All clients with your diagnosis feel the same way. B. I disagree. I wish I had your figure. C. Can you tell me why you feel that way? D. Don't worry, we can easily get you better. Question 72. A client diagnosed with paranoia insists that her food is poisoned. What is the nurse's best response? A. I'll taste it to prove it's not poisoned. B. Either you eat or we'll feed you by tube. C. The food is not poisoned, it's safe. D. Let's ask your family to bring in your meals. Question 73. Bereavement may be defined as A. The socially acceptable expression of a loss. B. The physical symptoms in response to a loss. C. The period of mourning after a death. D. Postponing awareness of the reality of the death. A terminally ill patient tells the nurse, "I'm afraid I won't be allowed into heaven." What is the nurse's most appropriate response? A. Don't worry, I'm sure God understands. B. What do you usually do when you're afraid? C. Can you tell me why you feel that way? D. Let me call the chaplain to talk to you. Question 75. Which action by the nurse demonstrates the ethical principle of autonomy? A. Decisions for the patient without their involvement. B. Respecting the patient's right to make decisions about their care. C. Withholding information from the patient to protect them. D. Coercing the patient into following the healthcare provider's orders.